Living with celiac disease or food allergy can feel incredibly isolating.
They didn't understand how I felt. They didn't really care about how I felt.
It's a daily battle that not everyone sees in a world that doesn't always
I
understand.
was gaining weight all the time, even though I was so active.
But it is also a journey of discovery where science and a passionate community stand right behind you, helping you move from just surviving to truly
Social
thriving.
Llama, not a restaurant or bistro. This is my house.
Your story is powerful, inspiring, and it's absolutely worth sharing.
What if I brought all of these gluten-free businesses that I'm finding together?
Welcome to Life Without Gluten. In this episode, I'm sitting down with Jedid, a registered dietitian and recently diagnosed celiac from the world-renowned Farncombe Family Digestive Health Research Institute. Our conversation focuses on silent deficiencies and hidden gluten.
Okay, so I wanted to transition into, so basically, when you go gluten-free and you clean up your diet, but then, as you mentioned already, there are some lingering symptoms, right, still. So, why is that?
There could be different reasons. So the first thing that we think about is maybe their celiac disease is not controlled, right? So if it takes longer for that celiac disease, the lining of the digestive tract to heal, you might have nutrient deficiencies, indigestion, where fats, protein, carbs are not well digested. So then that can cause some malnutrition.
Okay.
There could also be transgressions on the gluten-free diet. So maybe in the beginning you were doing things very strictly, and then later on there's here and there a little bit of a food that comes in that does have some gluten in it, or maybe the cross-contamination is not as well controlled. Sometimes traveling or eating out can be challenges for people to manage that there's no gluten in the food, or at least less than 20 parts per million.
Yeah.
There could be nutrient deficiencies, right? So those can cause symptoms. Sometimes there's functional symptoms or other autoimmune diseases, like hypothyroidism is very common in celiac disease. There could be other reasons, like maybe chronic diseases that slowly build up, right, as we grow older, diabetes, for example. So we have to monitor all kinds of markers in the blood, right, to see that the disease is well controlled and assessing symptoms well, trying to manage as good as we can.
And Judith, so basically, you're leading right into the question that I had is a lot of celiacs and people with food allergies would have that deficiency, right? The minerals and the vitamins deficiency, specifically zinc, calcium, vitamin D, and B12 vitamins, right? Would you mind elaborating a little bit more on that?
So unlike wheat flour, gluten-free flours are usually made up of starches, white refined flours like rice flour. They're not as nutritious, but on top of that, they're not mandated, according to the Canadian food laws, to be fortified. So they would lack iron, folate, vitamin B1, B2, and B3. And so those have multiple functions in our body, and if you don't choose the gluten-free diet wisely with high quality nutrient dense alternatives, some people skip meals, right? So they may just skip their whole lunch because now they don't like the gluten-free bread, for example, right? Or they may eat rice cakes with peanut butter, or maybe they eat crackers that are very refined. So it's not the same composition as their usual gluten-containing meal would have. Some people completely eliminate the gluten component, so they're not substituting with, let's say, quinoa or millet, or choosing brown rice rather than white rice.
Which are those all nutrient dense, right? Like grains, I guess.
Yes, that's right.
That's so interesting. So basically you're saying that because a lot of the products out there, I think, including the bread, they are fortified, right? Exactly like you said, with iron and other things. And the gluten-free products, most often not, right?
That's right.
Okay.
Yes. There are very few breads, for example, that would have iron in them.
Right.
But then they would still lack the folate.
Okay.
And they wouldn't have the vitamin B1, B2, B3. And there's very few brands of all-purpose gluten-free flour who have the fortification.
Yeah.
So I tend to recommend particular fortified products to the patients. But the best would be if you could make your own whole grain gluten-free bread, for example, right? Because that would also have less additives in it, less emulsifiers, and less of these starches.
Yeah.
To
So
make
something like having, millet or sorghum, right? I think this is something of the flours that I usually bake with, right? So would be probably in that category, in a nutrient dense category.
That's right.
Yeah.
Yes. Teff is very high in iron. Quinoa is a higher protein fiber component. You can also add seeds
Okay.
and nuts into breads and
Okay.
crackers,
Yeah.
right? Or dried fruit.
Yeah.
Those are all additional things. Or I often recommend adding legumes into
Okay.
rice, for example, or into tomato sauces,
Yeah.
making a soup with legumes.
Yeah. And you mentioned that, right? Like chickpea flour also is also very high. Is it high in those vitamins and minerals too? Like let's say
Yes.
chickpea flour. Yeah. Okay.
That's right. Yes. So it's good for protein,
Yeah.
for fiber, and then it also got the iron. The issue with the mineral absorption from plant foods is that they also contain, unfortunately, phytate.
Okay.
So sometimes it's better to go with an animal product.
Okay.
Let's say if you've got zinc deficiency, seafood and meat would be better products than, for example, legumes or nuts and seeds or whole grains like oats.
Okay.
They would be better choice because the phytate is preventing the iron and the zinc from being absorbed and being available for absorption.
Yeah. Interesting. No, appreciate you sharing that. And would you mind talking a little bit about what would be some of the key signs that someone is missing those, basic nutrients and vitamins?
Yeah, so for example, for iron transports oxygen to all of the parts in our body, right? So you can imagine if someone doesn't get enough oxygen going to their brain, they might get dizziness, fatigue, not being able to concentrate well. Some people get shortness of breath, right? Especially if they're climbing stairs, for example, they might faint. Other things is like cold hands and feet, even spoon-shaped fingernails, brittle nails, hair loss. Those are signs of iron deficiency. And then for zinc is highly involved in the immune system,
Okay.
but also important for wound healing and for muscle functioning. So if you're deficient, you might get more likely to get infections.
I don't think I knew that. Okay.
And wounds may heal poorly, right? It's involved in the protein synthesis, so even production of hair. And then for muscle functioning, you can get like muscle pains, so cramping, those things.
I think like everything that you just mentioned, I've had all of those symptoms.
Oh yeah.
And I was actually diagnosed with iron deficiency about a year ago. So I started supplemental iron to include it in my diet. And they have, it drastically has changed my just like lifestyle. So it's so important. And just listening to you is just like, it's an aha moment for me that like I've had these symptoms for some time and maybe somebody who has them or has been having them for a while. I think it's a good thing to look at, mineral and vitamin deficiencies, right?
Yes, exactly. And then if people are deficient, that would be the only reason we would recommend supplements. Not taking supplements if you just feel symptoms, but getting your blood test done to see that it's truly that particular vitamin or mineral that's low.
Yeah, that's a good point.
And then if you need to supplement iron, right, there's certain recommendations we have. So trying to take the iron with vitamin C, so either a supplement or with some orange juice or so, to help with the absorption. And then checking your blood level again in 3 months, in 6 months, to see how it is increasing. Some supplements don't work, so then we might switch the form of the supplement. And then it's important to separate, for example, iron from meals, because otherwise the iron interferes with the absorption of zinc or copper. So we want to make sure that you're getting as much out of your nutrition as possible.
That's an excellent point as well. So talk to me maybe a little bit about if someone, let's say, has been on gluten-free diet for some time, maybe a year or so, but the symptoms not completely have gone away, right? Is there anything else that might be going on that you could think of in the body, or maybe suggest something that maybe the patient could ask their doctor, or?
So in majority of the cases, there is gluten exposure.
Okay.
So the first step would be to see the dietitian, review your diet again, see that you're reading the food labels properly, recognizing all the different ingredients that contain gluten, and that you're able to avoid cross-contamination. And then if that's the case, then we know how to treat it. There could be functional symptoms, like I said, the irritable bowel syndrome, often like alternating stool pattern, like diarrhea, constipation, bloating, gas, can be very burdensome for a person, and can be related to, for example, stress, maybe the lifestyle, right, the diet pattern, or getting some exercise in would be also recommended. We have a particular app that we recommend to help manage some stress. So just becoming more mindful of what is happening in your life, I think is very important to pay attention to, and keeping your food intake regular, not skipping meals, making the meals balanced. Those are important strategies. And then there are other things that we can look into, like sometimes we ask a patient to collect a stool sample to see if maybe they could have inflammatory bowel disease or some parasite infection. Also for the functioning of the pancreas, sometimes it doesn't produce enough digestive enzymes. So then we can see that in the stool sample. And then we would recommend like prescription digestive enzymes. They're very important. With each meal, you'd have to take those. A colonoscopy can be done as well. And then they might take biopsies. This is if we think there's maybe microscopic colitis. And then some patients have small intestinal bacterial overgrowth. For that, we don't do any testing, but it will be treated with antibiotics.
Okay. You mentioned digestive enzymes. That's very interesting to me because I think, so, and again, correct me if I'm wrong, I think with a lot of the maybe intolerances or sensitivities, it could be a part of that, right? That you just don't produce enough enzymes. Is that fair to say? That the food is not digested properly because of the enzymes?
Yeah, so the lack of enzymes can cause indigestion. Yes.
Okay.
Yeah.
Interesting.
So then patients can see some of the food back in their stools, more yellowish stools, for example. And another thing that we see in very few celiac patients would be refractory celiac disease.
Okay. And what is that? I don't think I've heard of it.
Yes, that's if the patient does not respond to a gluten-free diet.
Oh, wow.
So their celiac markers come down, right? But there's still the lining of the gut does not heal.
Oh, wow. Okay.
So then we again take biopsies. They need to be specially tested to find out if that is the cause of the symptoms. And then those patients would have to go on steroid medication to help manage the immune reaction that's happening in the body, to calm it down and reduce the symptoms.
Yeah. Okay. Okay. Wow. Thank you for sharing that. So I wanted to kind of switch gear a little bit and go into the hidden gluten, because I could tell you myself, so my son has multiple food allergies, including wheat allergy. And I've been in the gluten-free living sort of space and learning about it for the past 10 years. And when I first started, I could tell you, I was shocked to find out that gluten is literally everywhere, I think. I mean, from the skincare products to, chocolates and seasonings, it's quite shocking. So I wanted to ask you in particular, maybe some foods that you could talk to us about, or some items that people just might not be aware of that contain gluten or might contain gluten.
Yes. First of all, there are many different botanical names for wheat varieties.
Okay.
So some of the patients, when I tell them about the long list of all these botanical names, they're not aware. It could be called dinkel, einkorn, emmer, spelt, kamut. Triticale, that's a hybrid between wheat and rye.
Okay.
So, and then any particle of the wheat kernel, so whether it is the gluten, of course, but then as well the starch or the bran or the germ, so those can all contain gluten. And unless they're labeled gluten-free, we cannot recommend them. And then for barley, for example, there would be malt, so barley malt extract or flavoring or malted milk. It's made with fermented barley. So you have to check the label very carefully for those ingredients. Regular beer, right, made with brewer's yeast. So that's also not a good product. But there are gluten-free beers made of gluten-free grains. So quinoa or millet, sorghum beers, those exist. So We cannot recommend.
I've yet to find one.
Yes.
To see, yeah.
Yes, there are some that I found recently, but unfortunately in the beer stores they don't have many options. So this is actually quite a barrier for some of our patients who are regularly used to drinking beer. It's hard for them to switch to a gluten-free alternative if there are only few options and they're not as palatable as the ones they were using. Yes, it's challenging, definitely. Some other hidden food sources could be contaminated foods like oats.
Okay.
So we have made a list of all the gluten-free oats, certain brands, the products, just because oats, legumes, as well as corn, they grow in areas where there's wheat, rye, and barley close to them. So then they become contaminated when they're harvesting it or processing it, when it goes to the mill, right? The mill is often a place where, for example, cornmeal or corn flour, they become contaminated if there's also wheat, rye, or barley being milled. So we recommend if a product first or second ingredient is made of cornmeal or corn flour, that they select gluten-free labeled products. The claim has to be there.
And Judith, I wanted to touch on oats because I think it's quite, well, at least from what I see, I wouldn't say controversial, but it is definitely a debated subject, I think, oats, because again, my understanding is oats are by nature gluten-free, but I think it's the process, as you mentioned, possibly, right, that the contamination around it, that people might be scared to try products, with oats or things like that. So would you mind diving a little bit more deeper into the topic?
Yeah, so there are two different methods how they could clean up the oats to make them gluten-free. So the first one is purity protocol, so setting specific standards for how the oats are grown in an area where they're not anywhere close to wheat, rye, or barley, making sure the harvesting and the transportation, the storage, all of that is in a clean, gluten-free environment. And then they're packaged also gluten-free. They're testing them regularly to stay less than 20 parts per million. And those are gluten-free. So we can trust those ones.
Okay.
And they will also say gluten-free oats in the ingredient list or on the label it will say gluten-free.
Yeah.
And then there are oats that are processed with optical mechanical sorting.
Okay.
It's a little less safe because these oats, they're contaminated during the process of growing, harvesting, transportation. And then they would use a optical mechanical sorter, a machine, to sort out any contamination. So if that machine is set fast, it may not be as safe. So unless they're testing it regularly and they have to test each batch multiple times, we need to be careful with those products. But there are definitely several of them that are very safe. And the producers, they're very careful with making sure that they're still, following those regulations for the gluten-free claim.
And I think like in Canada in general, I find we have pretty decent and pretty good labeling, right? I know in the US, at least from what I've heard, I don't know if oats or barley is part of I don't know if they label them as gluten-free or, I heard that there's a little bit of debate in the US going on. I don't know if you've heard about that and if...
Yes, unfortunately the food labeling laws there are not requiring to mention anything of barley or rye in the foods, so only wheat is labeled. So that makes it definitely more difficult.
Challenging,
Yes.
To find gluten-free foods, I could imagine.
Yes, that's right.
Gigi, I also wanted to ask you about dextrin, right? So I feel like I've seen a lot on labels, either maltodextrin or some sort of dextrin. What is it exactly? Do we need it? And is it something we should be concerned about on the gluten-free diet?
Yeah, so dextrin is a highly processed particle of the wheat kernel. It's a starch, basically, and like fibrous starch, and it basically can contain gluten, right? Because it's very hard to separate it from the gluten protein. But if the product is labeled gluten-free, right, then it has to contain less than 20 parts per million, so less than 20 milligram gluten per kilogram of that food, and then it would be safe. So there are some products that might be fine to consume as long as they say gluten-free.
So we just have to be careful about reading the label.
That's right. Yeah.
Perfect. Now, I did want to sort of finish off this segment with this. I don't know if you've heard, but I definitely have, and I've baked with the specific flour. So Caputo Furiglot gluten-free flour has been a phenomenon, I feel like, over the past, well, I don't know, maybe a couple of years in the gluten-free community, and people are raving about the results of it. Now, the interesting thing I found personally is when I read the actual ingredients, it said, I think it said like gluten-free wheat starch or something like that. And I was like, what? Wait, wheat? Why is there a wheat in here? So I got confused, and maybe some people might be confused introducing, if they're just introduced to this flour. Would you mind talking a little bit about that? Like, what does it actually mean?
Yeah, so the wheat starch, again, that's like the starchy part, the carb part of the grain kernel. But because they label it gluten-free, right, it actually is tested multiple times regularly. It's certified gluten-free. Okay. So there's even an organization that has reviewed that they're truly gluten-free. And the Canadian food laws, right, they mandate that these gluten-free claimed foods, that they have less than 20 parts per million. This particular product actually has less than 5 parts per million. Oh, wow. Okay. So with the gluten-free claim on it, it's definitely a safe product to consume. And many of the patients like it because it creates really good consistency, palatable, gluten-free baked products.
It's very also, like, there's a lot of elasticity I find to it. Like when I was baking with it, a lot of elasticity and airiness to the actual dough.
I see, yes.
Yeah.
I've never baked with it myself. Okay. It's not available in Canada, so you'd have to buy.
I know, you have to order it.
Order it.
I think I ordered it on Amazon, I think, so it's...
Yes.
Yeah, so you gotta order
That's right.
Yeah.
Yes.
A huge thank you to Jedid, but we are not done yet. Make sure to tune back in for the second part of this episode as we do some gluten-free myth busting and review popular gluten-free snacks. I'll see you then on Life Without Gluten.
Of table sugar. So this would be 3.5 teaspoons, right?
Is it for 3 cookies?
In the 3 cookies.
Oh my goodness.
So it's